Hello viewers, welcome to the Editorial Analysis by Drishti IAS. In this section, we regularly take editorials from various newspapers and news portals for a better understanding of various issues happening in India and around the globe. Dear viewers, in this section, we first try to link the editorial with our UPSC syllabus. Then, we go analytical in order to understand some key points and at last some important concepts. Dear viewers, we truly hope that you like this initiative taken by Drishti IAS and your feedbacks are important for us. So kindly feel free to give your important feedbacks in the comment section. So without any further delay, let's commence our session.
Dear viewer, this video is available in Hindi as well. If you wish to watch it, please visit our Hindi YouTube channel, Drishti IAS. For your convenience, the link for this video in Hindi has been provided in the description below.
Today's editorial is taken from The Hindu, published on 23rd of December 2020. The title of today's editorial is Pandemic Resilience. If we try to link today's editorial with our UPSC syllabus, we can link it with GS Paper 2, which has sections that include government policies and intervention for development in various sectors, issues arising out of their design and implementation, issues relating to development and management of social sector or services relating to health, education, human resources. If we try to summarize today's editorial, we can say that parliamentary panel's call for a new health law post-COVID-19 is a kernel for reform. Some key points from today's editorial. The report of the Parliamentary Standing Committee on Home Affairs calling for a comprehensive Public Health Act as a response to the extreme stress caused by COVID-19 is a welcome call to reform a fragmented health system. When the pandemic arrived, National Health Profile 2019 data showed that there were an estimated 0.55 government hospital beds for every 1,000 people. Now, the Parliamentary Standing Committee on Home Affairs, they have come up with a proposal that there has to be a comprehensive Public Health Act. Now, this act, if framed, would be taken as a response to the extreme stressful situation that was caused by COVID-19. And it also can be said that such a step will be a most welcome initiative for a fragmented healthcare system as present in our country right now. Now, according to the National Health Profile 2019 data, when the pandemic arrived, the number of government hospital beds which were available for every 1,000 people were at a very surprising figure of 0.55 government hospital beds for every 1,000 people. Such a sorry state it was. Prolonged underinvestment in public health infrastructure thus left millions seeking help from highly commercialized private sector with little regulatory oversight. The situation was even worse in rural areas where care facilities are weaker and urban workers fled to their villages, afraid of the cost of falling sick in the cities. See, because of such a tremendous amount of underinvestment in the public healthcare infrastructure, it made many millions and millions of people to go and seek help from the highly commercialized and highly expensive private sector. And private sectors have a very little regulatory oversight. Now, such a situation was even worse in the rural areas because no kind of regulatory authorities or no kind of such initiatives could have been taken. Now, those places where the care facilities were so weaker that the government, whether we are talking about the state governments here, primarily we are talking about the state governments here, that the governments have never ever tried to improve. When such a situation of COVID came, only then all these initiatives that now today we are talking about, today we are boasting about, they came into existence. Otherwise, before that, the situation of the healthcare infrastructure in our country was in a very sorry state. Now, the rural areas where the urban workers came, they actually came up with such an idea that in case if they fall sick in the rural areas, the condition or the expense would be quite less as compared to the tremendous amount of money which they have to spend if they get sick in the urban areas. Acknowledging these distortions and the inadequacy of the existing legal frameworks, the panel has called for an omnibus law that will curb profiteering during such crises and provide robust cashless health insurances. Now, all these things have been taken into consideration, and one thing that we never should forget. When this pandemic came, when the lockdown was announced, there were many private organizations who were taking this thing as an opportunity. They were taking this pandemic situation as an opportunity just to make money. So it has been decided that when such act will come into existence, when such a law will come into existence, it will actually curb the profit-making system of all the organizations, especially during such crisis. And also, it has been said that such a law will also provide cashless health insurance to its people. Its indictment of the feverish commerce surrounding healthcare provision, however, can serve a larger purpose if it covers overall system reforms addressing the structural asymmetry created by misguided policies. Now, we know that because it's over 70 years since our independence. And even today, now this is not the time that we keep on complaining about what has happened in the past. But yet, if we have such a sorry state, especially in healthcare infrastructure, then all the blame has to be put on the misguided policies which have been followed by various governments over the period of time. Now, the most important thing such a law should do, that it should do a complete overhauling of the entire system. And there has to be genuine reforms when it comes to the healthcare sector of the country. India has committed itself to covenants such as the Sustainable Development Goals, but continues to evade making the right to health a full, legal and justiciable right under the National Health Policy. See, India has regularly committed itself to the Sustainable Development Goals, and India always say that we are moving in that direction where we can make the Sustainable Development Goals a reality. However, it is India itself who has been continuously evading from making the right to health as a full legal and fundamental right under the National Health Policy. Okay, so this is the discourse that we have to see here, what exactly is happening. Now, every time what we are seeing here is we are talking regularly about the challenges which are associated with the public health system. Okay, now what exactly those challenges are? So we'll just talk about some of the challenges. Number one, lack of primary healthcare services. The existing public primary healthcare model in the country is limited in scope. Even where there is well-functioning public primary health center, only services related to pregnancy care, limited child care, certain services related to National Health Program are provided. This represents only 15% of all morbidities for which people seek care. Number two, supply side deficiencies. Now, poor health management skills, lack of appropriate training and supportive supervision of health worker prevent delivery of the desired quality of health services. Inadequate funding is the third very important reason. Funding, the biggest problem. Expenditure on public health funding has been consistently low in India. It is approximately 1.3% of the GDP, 1.3% on healthcare. As per OECD, India's total out-of-pocket expenditure is around 2.3% of the GDP. Another big problem is the overlapping jurisdiction. There is no single authority responsible for public health that is legally empowered to issue guidelines and enforce compliance of the health standards. Suboptimal public healthcare system. Okay. Due to this, it is challenging to tackle non-communicable diseases, which is about prevention and early detection. It diminishes preparedness and effective management for new and emerging threats such as pandemic like COVID-19. Now, what exactly can we do? What are the steps that we can take? Number one, we have to enable the preventive care. See, in order to promote preventive care, the union government has announced the conversion of primary health care centers into health and wellness centers. These health and wellness centers will act as the pillar of preventive care and gateway for access to secondary and tertiary health services. Bringing behavioral change. Now, there is a need to ensure people eat right, sleep right, maintain good hygiene, exercise, adopt a healthy lifestyle that necessitates concerted interventions at various levels of the system. In order to catalyze people's participation for healthy India, there is need for Swachh Bharat Jan Andolan on the lines of Swachh Bharat Abhiyan. Okay, more funding is required. At least 2.5% of the GDP should be given with reference to the healthcare segment. Okay, creation of a nodal health agency is also very important. One agency who has got all the rights, all the reasons through which it can definitely take the required amount of decisions, whatever is necessary. The present scenario. Among the committee's observation is the absence of insurance cover for many and oversight on hospital to ensure that patients are not turned away in crisis such as COVID-19. Now, one of the most important observations of the committee was the absence of insurance cover. See, many hospitals, they didn't cover COVID under the insurance cover that was provided to all the people by various companies. And in such a case, the hospitals, they have turned away people that, okay, no, this insurance is only limited for these particular diseases and not for COVID. And another way of making money was possible for the hospitals. While the panel is right to view this as a breach of trust, one of the pandemic's impact has been a staggering rise in premiums, especially for senior citizens, of even up to 25% of the insured value. Now, one of the most important thing that the panel observed was there was a immediate rise, a staggering rise in the premium, the amount which a person has to pay so that his insurance is working properly. Okay. So what we saw, especially in the case of senior citizens, there were many companies who increased their premiums almost by 25%. For example, if I was giving 10,000 rupees for my insurance health cover, the companies, for the same facilities which they were providing me under my previous health cover, they have charged 25% extra. That means I'm paying 12,500 rupees now instead of 10,000 rupees, which I was paying till last year. What is more, the insurance regulator, IRDAI, Insurance Regulatory Development Authority of India, set 65 as the maximum age of entry for a standard policy earlier this year affecting older uninsured citizens. Such age limit must be fully removed. See, there should not be any pattern. It should be completely upon the will of the person whether he wants to have insurance cover or not. Now, when you set up such a situation that 65 is the maximum age limit till when a person can enroll for a health insurance or not. Now, such is a situation which is very unlawful, or you can say it's not good. It's quite biased. Okay. The answer to creating an equitable framework lies in a tax-funded system with the government being the single and sole payer to the care providers. See, the most important thing which is to be noted here is when such a centralized insurance is being provided, the government should be the single and the sole payer to the care provider. That means if a person has got an insurance provided by the government, so it is the government who is directly paying. There should not be any company in between. There should not be any such organization in between, because this is the place where the loopholes are created, and because of such loopholes, people actually make their own profits instead of helping others. This is a long pending recommendation from the erstwhile Planning Commission and should be part of any reform. See, our Planning Commission has constantly been saying this thing, that such a scheme where government is directly providing for the health insurances of the people is a requirement, and it has to be one of the most important reforms in the coming time. Okay, but still no such decision has been taken yet. The way ahead. The government as the single payer, if not sole care provider at present, would be better able to resist commercial pressure in determining cost. This is equally applicable for central procurement of essential drugs, which can then be distributed free. See, we can have the benefits. We can have lots and lots of benefits. If government is the single payer, then definitely there shall not be the commercial pressure, the financial pressure that is over the people in such a situation. See, when a person is going through life or death, at that point of time, if money becomes a reason why a person has died, then definitely it is something we all have to be ashamed of. This is equally applicable for central procurement. See, there are many life-saving drugs which are not present at that point of time to the hospitals or the government hospitals or government dispensaries. Now, it has to be ensured by the government that they are the one who are also procuring the essential drugs and they are being provided to the needful for free. Legal reforms must provide for a time-bound transition to the universal state-provided health services under a right-based, non-exclusionary frameworks with state implementing it. Now, it has to be the duty of central government that it has to convince all the states to follow the same pattern. Private arrangement can be an option. COVID-19 has exposed the danger of excessive reliance on private tertiary care. See, private arrangements, yes, they are always an option, but we have seen many people. See, just remember, in the beginning, when the COVID got started, there were people who were accusing the hospitals of charging 15 lakh, 20 lakh, 25 lakh rupees for the treatment of COVID. And what exactly were they giving? There was no vaccine, there was no medicine, only hydroxychloroquine. Now, this was the time that many nursing homes, many hospitals have actually made lots and lots of money just by making sure that people who actually were in a state of panic, and all these hospitals have benefited from the panic of the people. The corrective lies in raising public spending to the promised 2.5 of GDP on public facilities that are universally accessible. Now, such initiatives, such things can only be done when there is an increase in the amount which is to be provided for the healthcare infrastructure, and it has to be increased to 2.5% of the GDP. Only then such a situation can definitely make sure that yes, the people can definitely get benefited. Now, we know that many things. The government has taken many efforts to address the shortfall in the public health system. Various schemes have been introduced: National Medical Commission Act 2019, Pradhan Mantri Bharati Jan Aushadhi Pariyojana, Pradhan Mantri Jan Arogya Yojana, etc. All these initiatives have been taken, and yes, government is working towards it. But what I'm telling you is the need of the hour is an adequate investment for creating a health system that can withstand any kind of public health emergencies, deliver universal health coverage, and meet the targets of sustainable development goals. So viewers, this was with today's editorial analysis. A question that can be framed with reference to today's editorial is: health infrastructure is an important indicator for understanding the healthcare delivery provisions and welfare mechanisms in a country. Critically analyze. So viewers, I hope you liked today's editorial analysis. Thank you very much.